I'm getting back with the coffee. Are you getting back with?
I don't know what this is.
This one is. Oh, another chamomile. Is it chamomile or green tea?
It is too hot. I don't know what it is.
You were saying a hot subject. You were talking about a very hot subject, which is power-assisted liposuction device.
Okay. Yes. So basically, I was about to say it. It is a vibrating machine. He is a very. No. Talking about me.
Hello.
and the device. So basically, it is harvesting the fat in a three-dimensional pattern. It decreases all possible complications and provides a more satisfactory result with a smoother skin surface. However, the most important thing for doing liposuction is the experience, because there are different fat layers, there are multiple anatomical structures, features. So in order to give a nice shape, you need to know from which layer, from which compartment you are harvesting your fat. And this is only possible to understand while touching. Okay. You need to understand, you need to feel the cannula, you need to know where you are, and you need to do it properly. So even though we use a lot of different devices, the best thing Clinichub is doing is developing experience, actually gathering experience and experienced doctors. So this is why we are doing this job in a satisfactory way. And after harvesting the fat, this is the first part of the surgery. Now we shape the body, we have our fat.
Shaping means according to demand of a patient. Some of them wants S shape, some of them wants straight.
That's right. Some of them wants defined abdominal muscles. Some of them want just a smooth skin with a small pouch on the tummy. So it's important to listen to patient, just like we talked.
Okay. Yes.
So I need to listen to patient. I need to understand what she is or he is talking about and decide what we are doing together. So this is what surgery is. And after having the fat, we are going to use that fat and inject it to proper places in order to give the shape to hip area, to hip region, and the gluteal region. Maybe we are going to increase the projection, make it more perky, rounder, lifted. So actually,
this is all possible to do with the fat transfer.
Fat transfer, that's right. It is, again, it's about experience. You must know where to inject, how to inject, to give the shape. Because most of our patients are actually not aware what can get from this surgery. And some of them, they do not actually know. They know what they want, but they don't know how to get there. So it is important to consultation right before the surgery and have a
Obviously, you do.
We are doing
video call.
Have a sweet maybe 1 hour before the surgery, just to listen, just decide, and after that, confirming everything together. Yes, this is very.
Most of your patients, they also receive international patients. I'm talking about. Or some of the international patients, we are delighted that they could come and see you or see us before they could...
It is not rare that after bariatric surgeries, the gastric sleeve surgeries, patients are having a consultation with me for...
Exactly, for 15 months later, 15 months later, 18 months later. So they're very lucky. So Clinichub bariatric patients, which we have near enough 100 patients a month receiving the weight loss surgery, they have the chance to see you for 15 months, 12, 14, 15, 16, 18 months later.
Just sleepers, rhinoplasty patients.
As well, rhinoplasty patients.
Their consultations after their rhinoplasty surgery.
But despite that, you still see all of your patients online. You do consultations in London because we do them together.
That's right.
And we've done one in Amsterdam.
That's right.
So
planning to do more.
Talk to patients is essential, don't you think?
That's right. It is the beginning of everything, to understand, to listen and to understand, to let the patient express what they're expecting from this and to be real, actually, because also I must be honest to my patients. This is what I can provide. This is what I can guarantee. These are question marks. If your expectation and my guarantees are matching, great, then we are good.
It's a perfect match.
That's right.
It's a perfect match.
So fats. Now we have the fats. So what
the fat is prepared,
that's right,
sucked out, stored somewhere waiting.
So there are different types of methods to inject fats. Okay, there is the short method, there is more complex ones, and things like that. So on. It goes like that. With Clinichub and all plastic surgery doctors, we choose to purify the fats, because when we harvest the fat, there are more than fat in this liquid. There is avascular tissues, soft tissues, blood, fluid, tumescent solutions, so many things next to fat. So you need to purify the fat in order to survive. Because as you know,
in order fat to survive longer.
Fat to survive in the long term. Because I'm hearing from many patients, I heard that half of the fat goes away 2 months later. That's why I want it really big. So I'm always correcting my patients. When we inject the fat, it's going to stay as it is. Because how we prepare the fat guarantees it to survive. We remove all other tissues, all other tissues, just fat tissue remains inside. And when you inject
live fat tissue,
pure fat tissue, it almost always survives.
Yes,
it's
indeed.
either rare, it melts.
I have seen many of your patients want a reduction after.
That's right, and yes, that's correct. And now 6 years later, we started doing reduction.
Yes, I think 6 years later we're gonna start reducing what we made bigger.
That's right.
Joke aside.
Yes, that's it. No, it's possible.
It is.
You make it smaller now. Since for the last 6 years we have been augmenting the butt. Now
There's always business.
it's always possible to
Thanks to woman. Thank you guys. Because of you, the world continues. Keep spending your money, your husband's money.
This is for them only. Don't. Okay, it's about making people happy.
Look, the economy ticks along with women spending, ladies spending. You know, I mean, I'm a married man. My wife spends, and I have to work hard, and the economy ticks. So this is what I'm saying. I mean, there's always woman wants something for themselves.
Happy wife, happy life. I think that
I learned this.
yeah,
I learned this. No education needed.
the easy way.
In the easy way.
That's right. And so
Hands up.
That's right. And after injecting fat and reshaping the gluteal region, the surgery finishes, and right there the post-operative care starts, which is as important as the surgery itself, because the surgery is about me, and right after your surgery, everything about me finishes. I cannot physically do it.
Put a percentage to it. What? How much is the surgery? How much is the pre and post-op?
I mean, it's hard to, but they are equally important, because I reshape your body. The next day, if you do not start taking care of your body properly, you are not going to keep that shape 1 month later.
I always say 40% surgery. I mean, all these years I have been a coordinator myself. All these years I have had the privilege and pleasure of talking to people and introducing these surgeries. And I've always said to people, look, the surgery is, to me, 40%. The rest of it is down to your mindset, down to how much you want to keep what's being done to you or what has been done to you, and how healthy you want to continue. Walking, drinking enough fluids, having right approach to life, you know,
everything.
So I think that's a 60%.
Eating, drinking, mobilization, FAHA stage 1, first stage FAHA, second stage FAHA, lymphatic
Massages.
I mean, your life, starting gym, start being mobile.
New work, new job, new husband, new wife, new partner. Yes.
There are so many aspects to it, and just like we spoke, it's equally important, and it is really important, especially in your first month. After your first month, you are going to 90% of your life, your social life, will be okay. I mean, you will be able to continue your life without any disturbance. But for the first 2 months, you must mind small details. As long as you follow small instructions we are giving you, you are going to have a really satisfactory result from this. And this is a mental and physical process. You need to listen, you need to follow our instructions, and physically, you must be prepared to take it, tuck it in.
Exactly.
That's
exactly.
So this is the journey
of a BBL and a general idea of a plastic surgery.
And also, I mean, there will be a swelling process. Your body will be swollen after the surgery. On the operation theater will be visible a couple of months later, because the next days, which are called the post-operative regret days,
it's true.
It's true. The next day, your body will start getting bigger. And in the first 2 weeks, it will gradually increase.
So the need of FAHA to compress is
really,
very essential.
Really important.
You know, unfortunately, some of the patients because they feel how I don't know, maybe not so comfortable with it, they prefer to take it out, and then that swelling then takes months to.
That's right.
So it's very essential. How many days would you say the first stage essentiality is?
It is personal, but usually before the end of the second week, the necessity of the first stage faha usually diminishes. So 2 weeks after your surgery, you will get your second stage faha, which is
Generally smaller.
There's a smaller, tighter, like Victorian, Elizabethan age faha.
Oh yes.
Is something like this. So it's going to be your next best friend for the next 2 months. It's going to define your body, but also there are really small details to follow. For example, small things when you tie up your faha, for example, underneath your skin must be smooth, because when you put on something tight, it usually creates wrinkles.
Yes.
This is a small thing. If you miss that, this is a revision. You have to treat this 6 months later with another revision.
Yes.
That's why my patients, they are getting a voice memo from me, 15 minutes long. I'm talking for 15 minutes. So they are getting bored of me listening to it. So, but those instructions are really important. And about the swellings,
well, we have written them in the past. Nobody read them, so we told you to record it. I hope they are listening to them.
they do.
They do.
I know they do. But of course, there is never an end to questions, and that's why they are always able to get back.
Each person is in each case.
I mean, I'm getting so different. Even I don't know the answer. For example, I had a question like, when can I scuba dive? That's a really unique question, and I had to look it up. 2 months later.
That's after mommy makeover. What was it?
It was VBN.
VBN.
So 2 months later, you can dive. So that's right. So
what a change your BBL surgery makes in people's lives.
That's right.
Are they floating better? I swear.
I thought about the same thing, but I hold myself back.
Sorry.
I know.
I don't know if you want to cut that, but yeah, maybe they are floating better. We don't know.
Betsio.
Betsio. No. I mean, that's a joke. I mean, we can joke, right? And
so that's 2 weeks after your surgery.
I think for the first session we've done amazing, but you involved the post-care. Let's talk about briefly the post-care process with Clinichub here in Turkey, in Istanbul, after the surgery, because generally they stay about a week after your operation, and during that time, what we do with your under your surveillance or under your supervision, what my nurses, our nurses and doctors, post-op doctors do.
So intense, the details are too many. Even I don't know all aspects of the surgery. You know better than
I do.
But generally, our patients arrive Turkey.
It's on the salary list, I know.
our patients arrive to Istanbul 2 days prior to their surgery.
Yes.
Because of the anesthesiology medication. We do their blood work. They are having a consultation with the hospital, with the anesthesiology team. They usually see me before the surgery. And if everything is all right, if we are good to go.
If they're not pregnant?
If they are not pregnant, there's no...
If this week you had a pregnant patient?
Yes, 2 days ago, my patient was pregnant.
She wasn't aware she was pregnant.
She's keeping, but she decided to keep the baby.
We're going to have an amazing baby.
Like once a month, yes, we diagnose a pregnancy. I don't know if it's the right term to say it, but we catch...
Before the surgery.
That's right. So,
yes.
And 2 days before the surgery, they are here. If everything's good, if you do not diagnose an underlying condition or something like that, we proceed. In lipo patients,
blood issues, for example.
That's right. In lipo patient, breast patients, or face surgery patients, they stay in the hospital for 1 night. If you are having a combination surgeries like tummy tuck, my makeover, and things like that, I'm keeping my patients in the hospital for 2 nights, checking their blood level, everything. And after I make sure that everything is all right, 100%, only after that we transfer them to our post-operative facility. Our hotel is basically another hospital. There are like 20 nurses, 3 post-operative doctors, patients, specialists, everyone.
Yes.
So at our post-operative facility, we can provide everything that we can provide in the hospital. So painkillers, antibiotics,
basically
everything.
What we call, because we are legal. I think one of the few, maybe only legal post-op legal entity which holds post-op operative certification, Clinichub Prime. We are legally authorized to touch patients in their hotel room. This is very important because this job is done by many doctors now, and all of the doctors after the hospital stay, they allow their patients to go to hotel.
But also,
And
we need to underline the importance, because when you are legally responsible, this is something great for the patient.
exactly.
Because if something goes south, they will find someone in front of who is legally responsible.
Exactly. So, for example, a doctor who done the operation and tells them to go and stay so on in so and so hotel, and I will send you my nurse tomorrow and the day after. Great. But is this nurse by the government authorized authority allowed to touch you? Probably not, because in Istanbul, I think we are the only one. Clinichub Prime is the only one that has this authority to touch people and do their massages, check their incisions and so on and so forth, and report to their operating surgeon. So I think we need to make that point very clear. When people are searching for a surgery, they are searching for a safe surgery, but they should also search for safe surgery journey, which involves our services, Clinichub Prime services within this.
And Clinichub prefers to be legally responsible from everything.
Yes, I do.
That's
Yes, I do. That was my idea of starting the business. I have lived in the UK over 24, 25 years now, and I'm Turkish citizen as well. And when I had the thought of setting up a medical tourism company, because I struggled myself in the UK for simple basic things that NHS offers, like tonsillitis problems, temperature and so on and so forth. And to go in a hospital and wait for 6, 7, 8 hours in the accident and emergency and being offered paracetamol was sort of bulb on my head and saying, okay, these people is in agony, and I see other patients and so on and so forth. I need to be able to offer an affordable medical service. I mean, having said that, we've talked about your proficiency, which you're fantastic at. Clinichub not only offers plastic surgeries, rhinoplasty surgeries, and hair transplants and dental care, but we also offer orthopedic surgeries, IVF, eye surgeries, and gynecological surgeries. Women health especially is a big thing. Our 90% of our patients, I would say even over 95% of our patients monthly, which equals to about 400 international patients, are women. So therefore, women have various womanly problems. Some of them we cannot advertise like we advertise BBL on the social media, but nobody should be stopped if they are suffering, say, problem in their womb or stomach area or something related to, woman issues. They should, or genital areas, they should not be scared to ask us, because we have great team, great partners, doctors, hospitals that we work with and offer these to women all around the world.
I need to intervene.
Please
because
do.
we forgot to say something. Since, thanks to Clinichub, we are performing our surgeries A+ hospitals, the most established hospitals in Turkey. While expanding, while gaining new members to our family, we are usually connecting to doctors, to surgeons who are already good enough to be able to work in those institutions. Now you can proceed.
Exactly. So these are very famous surgeons already. These surgeons, these doctors that we will connect you are the surgeons and doctors and establishments and hospitals that has been brilliant at that particular branch. For example, we've done many IVF. For example, we have operated, like you said yourself, you have been involved with finger surgeries.
I just recently recommended someone to you myself, and you just did an agreement with.
I mean, we've helped an African boy, amazing young, 5, 6 years old boy who had, unfortunately, 2 fingers, but our microsurgeons gave him 5 fingers, for example. And another one who was not able to bend the arm, we helped operate his arm better. So like myself now. So back pains, We have departments like pain management departments. You call that in terms algology, pain management departments. For example, people wake up in pain. They don't know what. For what they have pain. They have consulted various surgeons around the world, or doctors, or GPs. They cannot find the solution. We have these pain management systems. We have also partners in if you are suffering with drug-related issues and you cannot give up, even giving up smoking or alcohol-related issues. We have amazing partners that works with us and helps you get better in the future. So it's all round amazing organization. Thank you. So thank you again. But it's not because what we do. It's because of the patients that asks us questions, and also the partners like yourself offers this.
We evolved by listening to our patients. I mean, they were just BBL at the beginning. There was just BBL, and we evolved because they had other problems. They consulted us. They actually recommended us something. So listening to our patients help us grow and evolve and get bigger.
Thank you. Well, Burak, it has been great having you. I think for the first one, can we say it's safe to say it's been amazing, and I think we should do this again.
I think we should.
We should do this again, and thank you for listening to us.
Okay. So thank you.